Hi, I'm Dr. Art Bartolozzi, and I'd like to talk to you about arthritis. Now, this is a big topic, and it would be very difficult to address the entire topic right now. But I'd like to tell you what arthritis is and what we can do about it. Arthritis is basically a wearing out of the joint. So arth stands for joint, and itis is inflammation. And basically what wears out is the cartilage and the structures inside the knee. The most common kind of arthritis is a wearing out arthritis, which is called osteoarthritis. But there are also inflammatory arthritis diseases, which you may have heard of. Rheumatoid disease is one, or rheumatoid arthritis. There's also an arthritis associated with some of the inflammatory bowel diseases. But the most common type that we see is osteoarthritis, wear and tear of the joint. When you have osteoarthritis, the most common symptom is achiness or swelling or persistent pain. If it's in the knee or a weight-bearing joint like the hip, and the most common joint that I see is the knee, patients will experience pain with daily activities, pain at rest, pain with certain functional activities, and it becomes quite a nuisance. And as you get older, the joint continues to wear out. So what does wear out? When the knee wears out, what does wear out is the articular cartilage. So if we look inside the knee and we bring the kneecap back, what does wear out is the surface of the knee and the meniscus, which is a mobile bearing inside the joint. So patients with arthritis can have a torn meniscus on an MRI scan. It's different from the torn meniscus that occurs from playing football. This is a wear and tear as compared to a tear. And the difference is, if we remove a wear and tear with arthroscopy, patients sometimes don't get better. If we remove a tear that's getting caught and getting stuck and getting caught and getting stuck, patients will have a very high incidence of success with that surgery. So if you have an achy knee pain and your MRI shows a tear, the first line of treatment for that is not necessarily surgery. The first line of treatment for arthritis, most kinds of arthritis, is conservative management. And so I can talk to you a little bit about what the options are for conservative management. One option is, and the first option is, reduce your activity that's causing pain, change your intensity, frequency, or duration of exercise. So that's an easy thing to start. If you have advancing arthritis, you may need to take the stress off the joint by using a cane or a crutch. Now, there are then 5 interventions we can do. Pills, which would include anti-inflammatory medication, that would be Aleve or Advil, and there are also nutritional supplements like glucosamine and chondroitin that have been shown to help some patients with arthritis pain. And then there are other non-anti-inflammatory medications like Tylenol, and there are some prescription medications that your doctor can talk about with you. The next option are injections, and the most common injection is a steroid injection. Some patients say, well, I'm afraid to have a steroid injection. I think it can cause damage. And in fact, too many steroid injections can cause damage. But already the joint is deteriorating, so we're trying to control some inflammation. We can't do a steroid injection or a corticosteroid injection, as they're called, weekly. We can do 1, 2, or 3 a year, and oftentimes, if they're well placed, you'll get good relief. Another whole series of injections, another family of injections, is what's called viscosupplementation. And these are lubricants that are injected into the knee. They're derived either from rooster combs, from the part that hangs down on the rooster, or from bacteria. And the material is called hyaluronic acid. And this is a very viscous material. It feels like oil or STP oil treatment, if you know what that is, for your car. But that's what it feels like. And it's in bath oil beads. So this material gently lubricates the joint. It's not effective in everyone, just as corticosteroid injections are not effective. But there's about a 50% success rate, and some patients experience pain relief for up to a year. The next option for treatment after injections is bracing. And if the knee is becoming more crooked or more malaligned, or if there's pressure on one side versus the other, there are several types of braces we can use. We can use an elastic support, which is considered a brace. We can use an elastic support with hinges, which keeps the stress from occurring in the knee. So you might imagine if we put a brace on this knee and we put a brace on that reduces the rocking of the knee, you may experience some pain relief. And finally, there are braces that can take the stress off the side of the knee that hurts. So if it hurts on this side of the knee, there are braces that actually can take the stress off that side of the knee by gapping the knee open. And in some cases, they're very useful. So the next option after bracing is physical therapy. Now, it's very important to understand that if you do physical therapy, deep knee bends, squats, heavy weightlifting, it's going to irritate an irritated knee. So it's important to have a physical therapist who understands the problem, understands the physiology of arthritis, and understands how to perform gentle strengthening and sometimes stretching exercises without causing pain. If you do physical therapy and your pain gets worse, then you need to modify that or stop it. And finally, the last option for treatment of arthritis is surgery. If the knee is damaged, bone on bone, and crooked, it's unlikely that cleaning the knee out with an arthroscopy will help. So in advanced cases of arthritis, we perform knee replacement surgery. In mild cases of arthritis, with some catching or mechanical pain, sometimes arthroscopy is helpful. I hope these comments have helped you better understand the options for treatment of knee arthritis.